Hello, so welcome back to my YouTube channel. This is HBM. If you're just coming across me for the first time, please subscribe to my YouTube channel, like and share my video, and do not forget to turn on your notification bell below. On this channel, I teach you how to make skincare product. I do product review. I talk about skin, how you can take care of your skin.
I coach or train you on how to make effective, stable skincare product for personal use or for business purpose. I also sell my skincare product on my website at www.hbmorganicbeauty.com. And if you want to reach out to me, kindly click the description box under this video you're watching now and click on my link tree so that you'll be able to reach out to me and follow me on other platforms.
I just want to talk about melasma. Like, so many people have been having misconception when it comes to melasma, exogenous ochronosis, sunburn, hyperpigmentation in general. So I'm here to just clarify you about this. I'm here to discuss a topic which is actually the best acid, exfoliating acid you can use in treating melasma. So I know mostly I've been doing DIYs, but the truth is that there are some things we need to discuss about. So melasma is a type of hyperpigmentation whereby brown patches appears on the face, which can be due to hormonal changes or exposure to the sun, or we call it sun exposure. But it's just that when it comes to differentiating hyperpigmentation, melasma, hyperpigmentation is just like an umbrella name for melasma, freckles, liver spots. The truth is that you get this pigment due to sun exposure or due to hormonal changes, especially when you're pregnant. Like when you're pregnant and you start having melasma, you start having brown patches on your face, some parts of your face start becoming darker, or you start producing too much melanin on some part of your body. That is because you're undergoing hormonal changes. Okay, despite the fact that you're not exposing yourself too much to the sun, you're being careful of the sun, you can also have melasma due to hormonal changes, especially in women. We women, we have issues a lot with hormonal changes to compare to men. So hyperpigmentation is just an umbrella name whereby you get in other skin conditions such as melasma, you get liver spots, age spots, you understand. So now some people mistake hyperpigmentation to a kind of sunburn that we call exogenous ochronosis. Now, exogenous ochronosis, some people mistake exogenous ochronosis to sunburn. Some people will come and they will show me some kind of hyperpigmentation they're having, and most of the time when they tell me the history of them treating such skin problem, I just tell them, please, why not go to a dermatologist? When you go to a dermatologist or an esthetician that knows what she's doing or what he's doing, they have a kind of equipment they call wood lamp. Yeah, this wood lamp is being used to diagnose your skin, especially your face, when you're having chronic sunburn that refuses to go, that keeps coming and going. If you're having such situation, I advise you, please just visit a dermatologist, or you just visit an esthetician that knows what they are doing. So they are going to examine your face, they are going to check your skin layers and confirm to you if you're actually having melasma, or you're just having an ordinary hyperpigmentation, or you're having exogenous ochronosis. Now, exogenous ochronosis is different from the normal sunburn everybody's shouting about. Is different from melasma, is different from hyperpigmentation. Now, hyperpigmentation, melasma, sunburn can be treated easily using some skincare ingredients. Okay, it can be treated fine. You have to be patient while treating these skin issues. But when it comes to exogenous ochronosis, which is the chronic, let me just put it in a way everybody will understand, the chronic sunburn that you keep complaining of, that have gotten to the dermis of your skin. Now, the dermis of your skin is under the epidermis of your skin, so you have to notify all this. To treat your skin from the dermis is very, very hard. And when you have exogenous ochronosis, it is coming from your dermis. It is no longer from the top layer of your skin. The top layer of our skin is our epidermis. Now, skincare product can penetrate to your epidermis and work very well, but skincare product penetrating to, you know, another skin layer beneath your epidermis is, you know, I just advise you, just go to an esthetician or go to a dermatologist. Let them assess you, let them check you up and tell you the layer of the hyperpigmentation you're having. If it is exogenous or chronosis, that means the best way to treat such sunburn or hyperpigmentation, let me just put it in that form, is for you to just treat it in an aesthetic way, either by going for a laser treatment. Laser treatment is very, very good for treating such skin problem, okay? Because I will not advise you to keep waiting for product that contain glycolic acid, tranexamic acid, kojic acid, or, you know, just go for a laser treatment. When you go for a laser treatment, your dermatologist should be able to follow you up with some of these skincare products while you're also on your laser treatment. So let me just, you know, stop there and let's just go straight to today's topic. And again, before I move forward, please, we're having a free class, okay? We're having a free class on our Telegram group. I'll be teaching you how to make an exfoliating brightening face toner. I'm giving you real recipe. It's a free class. I'm giving it out for free, and I'll also be teaching you how to make a brightening face wash. So if you know you're interested, under the description box of this video, just click on the Telegram group and it will take you straight to our Telegram group, and join our Telegram group channel for the class. The class is coming up very soon. So now, what are those best exfoliating skincare ingredients you can actually, you know, use in treating melasma? Now, the number one is glycolic acid. Glycolic acid is very, very superb. It's an exfoliating acid that interferes with the production of melanin. Melanin is the dark brown or dark pigment that naturally occurs in our hair, our skin, the iris of our eyes, okay? And when you're producing much melanin, it makes you go darker. That means probably you're being exposed to too much of the sun rays. You know, you start producing too much melanin, you start having, like, you know, brown patches, dark pigments on your skin. So sun damage activates melasma. So this is why you need to protect your skin a lot. That is why when we are shouting, put on sunscreen, put on sunscreen, most people, they don't want to hear. But you know, we're only saying this so that you can be able to protect yourself. I don't joke with my sunscreen. Probably one of these days I'll be reviewing some of the sunscreen I've actually used, okay? So you have to try and protect yourself from the sun. Glycolic acid is actually an exfoliating acid. It's one of the best and most used exfoliating acid that skincare formulators use a lot, because it is very, very good. It is very, very potent in shedding off dead skin cells of the skin. It helps in renewing or reviewing a beautiful, glowing new skin. And again, if you're treating melasma, like you have melasma on your face, you have melasma, I will also advise glycolic acid chemical peel. You can start with 30%. 30% is still a mild concentration. Then you can go up to 50%. All right. So I will advise you go for a glycolic acid chemical peel. Trust me, when you go to a good esthetician, a qualified esthetician, and you do glycolic acid peel on your melasma, you're going to see results. You're going to see results. But please do not do this by yourself in your house. You have to go to an esthetician. They are going to tell you product to use, that is pre-care products and post-care products after the peel, because going for a chemical peel is actually a procedure. You don't just wake up one day and go for a chemical peel. All right, so now is it that you use your glycolic acid in form of toner, but if you want an effective, faster result, go for a glycolic acid peel. Glycolic acid peel is actually used to tackle melasma. It tackles melasma a lot. By the time you do the first procedure, you're going to see results. So by the time you also do like the third procedure, by then your melasma will be completely gone. Trust me on that. So now the number 2 acid that I'll be talking about that works very well is our azelaic acid. It's actually derived from wheat, it's derived from barley, and it is used at the strength of 20% in case you're using it for a pill. For a beginner, yes, 20%. Your esthetician will know better. They know how to introduce this acid to your skin. Now, you can also use your azelaic acid in form of toners, in form of serums, okay? Azelaic acid has brightening powers in them. They actually help to brighten out spots, they help to exfoliate the skin, they help to reveal healthy glowing skin after the azelaic acid might have shed off the dead skin cells on your epidermis, so they help to reveal a glowing brighter skin. Okay, so now there are also other ingredients that I'll be talking about in my next video that you can actually incorporate. I'm talking about acid now, exfoliating acid. So there are also skincare active that you can incorporate into your cream that you can also apply after using this exfoliating acid, because after using exfoliating acid, after exfoliating your skin, of course you need to follow up with, sorry for that, you need to, after exfoliating your skin, you need to follow up with some good products, okay, as your post-care products. All right, so now let me go back to azelaic acid. It improves melasma by encouraging cells turnover to exfoliate the skin and promotes new healthy skin growth. It also has an antioxidant properties that remove free radicals that can contribute to dull skin. So azelaic acid will naturally brighten out your complexion. Trust me on that. It exfoliates your skin. It promotes new growth of healthy skin, and at the same time it helps to brighten out hyperpigmentation. So you need to try this glycolic acid, azelaic acid. So the third acid I'll be talking about is actually lactic acid. Lactic acid is much more gentler than glycolic acid. Lactic acid is most time prescribed for sensitive skin. When you go for chemical pills, you know, and they examine your skin and they notice you're having sensitive skin, most estheticians go for lactic acid. They start with a smaller concentration of lactic acid. Lactic acid exfoliates the skin, is also an alpha hydroxy acid. Okay, glycolic acid is also an alpha hydroxy acid. Now lactic acid exfoliates the skin, and it's also good for skin that are suffering from wrinkles. Okay, so it helps smoothen out wrinkles. It helps reveal a brighter glowing skin, a brighter firm glowing skin. So it also helps to tackle hyperpigmentation, acne spots. All right, so lactic acid is very, very superb. It is being derived from milk, as we all know. So you can use lactic acid in form of toner. You can do 5% lactic acid toner. Yeah, it's going to work. These are chemical exfoliants. Glycolic acid too, they are chemical exfoliants. Azelaic acid, they are chemical exfoliants, so they work faster, especially for your facial products. Chemical exfoliants are best for facial products than your physical exfoliants. Your physical exfoliants are your sugar scrub, your salt scrub, your abrasive scrubs. Okay, your chemical exfoliants are very, very super. They work faster for your facial product. So you can use your glycolic acid, as a toner before you go on and apply other products to tackle your hyperpigmentation, because we have various ingredients, skincare actives that you can use to make creams or serums for hyperpigmentation, or call it melasma. So now lactic acid, like I said, is suitable for a sensitive skin, and it works on, it's very, very good or effective for our epidermis, because it works based on the epidermis layer of the skin. Okay, so now we're talking about Mandelic acid. Is another kind of acid that I love so much. I like to use this acid. Number one, is more gentler than lactic acid. Like when an acid is more gentle to lactic acid, so it will really irritate the skin. I've not seen somebody that used Mandelic acid and complained of skin irritation, because it rarely irritates the skin. It is milder, very very mild to lactic acid, and it has brightening components in it. It exfoliates the skin and it has brightening properties in it. Yeah, it has brightening properties to even out the skin tone, to brighten out dull complexion, to clear off hyperpigmentation, sun damage, sunburn. Trust me on this. Mandelic acid is superb. If you can go for mandelic acid in form of peel, superb. You're going to love your skin. Like, you're going to have an even skin tone. If you're having hyperpigmentation, it's going to clear off your hyperpigmentation. Okay, so mandelic acid is actually an AHA, is an alpha hydroxy acid family, and it is more milder than lactic acid, which can lighten out dark spots and melasma. It can reduce 50% of melasma from 5 to 6 weeks. This is tested and trusted. Like the shower gel we are selling currently, the shower gel we have currently at HBM, I'm using the shower gel and I notice an even skin tone. Yes, just with using that shower gel. The shower gel contains mandelic acid and I notice an even skin tone. It's mildly exfoliated. Like, I'm seeing this mild peeling, not like, I'm not seeing excessive peeling, just like a very mild peeling. You know, when I touch, at times before I cream my body and my skin is dry, I'll see that, you know, my dead skin cell, like I see those dead skin cells shedding. So it is working very very effectively. So mandelic acid is superb for you. Please, you can try mandelic acid. So now the thing you must have in mind when using all this acid to treat hyperpigmentation, you must know that this acid, they leave your skin sensitive to sun. When you're using this acid, please always wear sunscreen. And you know, the sun is mostly hot or mostly skin damaging around 10 a.m. to 2 p.m. Trust me. So try as much as you can to avoid the sun, or don't be too exposed to sun, and make sure you're using sunscreen. And how do you apply sunscreen? After applying your skincare products, wait for 30 minutes, then you apply your sunscreen. Apply your sunscreen on all the parts of your body that are exposed, but try as much as you can to also put on clothes that will cover your skin. Try as much as possible to put on glasses, you know, the sun glasses that will be bold enough to at least cover from here to here. Try to put on face cap. Try to shed yourself away from the sun. This acid I mentioned, they work very very well to treat hyperpigmentation, whether it is melasma, whether it is sunburn, but not exogenous ochronosis. If you're having exogenous ochronosis, I'll be putting up the picture. Please go to a dermatologist. You need a laser procedure. You need to either go for a microdermabrasion or laser procedure to actually treat your exogenous ochronosis, because those are the treatment, especially laser, they get beneath the epidermis. That is, they cross the epidermis and goes to the dermis. But you using steroids, they are not going to help you. When you're treating exogenous ochronosis with steroid, you notice that the steroid will only be bleaching that spot. By the time you stop, the place becomes more worse. Okay, so now do not be exposed to sun. Always make sure you're using your sunscreen when you're using any of the alpha hydroxy acid to treat your sunburn or hyperpigmentation. Alpha hydroxy acid, they are very very effective to treat hyperpigmentations, but at the same time you have to be careful while using them. So in my next video, I'll be telling you or teaching you those skincare actives like your tranexamic acid, like your kojic acid, like, you know, other skincare active you can actually use in making serums or in making skincare creams that you can apply afterward or follow up with this exfoliating acid I've just talked about today. So thank you so much. Go and join my Telegram group See you in my next video, and try out any of this acid. If you're a skincare formulator, you can try making serums, toners with them. You can make serums with them. You can make a face mask. That is a jelly face mask with them. And if you're not a skincare formulator, you're having hyperpigmentations, you can buy from skincare vendors. But when you want to buy, try to make sure you look out for any of this acid, or better still, if you know you have exogenous ochronosis, please, you can reach out to a dermatologist or an esthetician so they can treat you, or probably prescribe a pill for you, because trust me, pills work. They work very, very well for hyperpigmentation. So another thing, what do I want to say? I wanted to say something, but I cannot remember. I can't remember. Okay, so that will be all for tonight. So see you guys in my next video. Turn on your notification bell, because the next video is gonna be bomb. So see you in my next video, and bye.